Good morning, everybody. My name is Juan Rivera. I am the General Director of the Instituto Nacional de Salud Pública in Mexico, one of the host institutions of the conference, and I will be moderating the session. This great plenary session has as the title, Conflict of Interest Related to the Food Industry and Advocacy. Food industry has a history of interfering and undermining nutrition policies aimed at reducing the intake of sugar-sweetened beverages and ultra-processed food products, which are risk factors for obesity, chronic diseases, and premature death around the world. We have three great panel speakers today that have a trajectory of research and publication in this topic, and they will address different aspects, including research funding by food industry as a way to favor sponsors' interests, how this leads to scientific bias and represents conflict of interest, how is food industry shaping policies and manipulating public health, and how have nutrition policies have faced opposition from food industry in Mexico, and how we have been able to partially overcome their efforts and action. Every speaker will be presenting about 10 minutes, followed by a discussion of 20 to 25 minutes. You can ask questions in the Q&A box, and I will try as much as possible to ask our speakers to answer those questions. So the first speakers, and I'm really glad to have her here, is Marion Nestle. Marion, could you please turn on your camera? Marion is nutrition and public health in the New York University, and she will be speaking about food industry influence in nutrition research. Welcome, Marion, and you have the floor.
I have the floor. Okay, I have to share my screen and do all these confusing things. Let's start with that. Oops, how is that? I'm confused. What's happening here?
Great. It's great. You just...
It looks like there's two of them up. I'm very confused.
I was watching the
yeah, somebody has to help me with this because I don't understand what's happening. It's going.
Marion, this is Cole. Right now, you're not sharing any screen.
Now
I see your desktop. Looks like you're opening a PowerPoint.
Yes, thank you very much. I'm so sorry.
No worries.
There were two of them before. Hello, everybody. I'm very, very glad to be here. It's an honor to be able to talk to you today at this conference on this extremely important topic. I write books about food politics. Here they are. And one of my more recent books is a book called Unsavory Truth, How the Food Companies Skew the Science of What We Eat. And in that book, I reviewed research on how industry-sponsored research affects the outcome of studies, how the food industry influences nutrition societies, nutrition advisory committees, and how all of that ends up affecting nutrition and food policy. I think a very important issue and well worth the book. The easiest way to discuss what this is about is to give an example. I particularly like this one. This was a study of the association of candy consumption with measures of body weight, cardiovascular disease, and diet quality. And as the press release for this study said, a new study shows that children and adolescents who eat candy are less overweight or obese than children who don't. Whenever I see a headline like that, my immediate question is, who paid for this study? And in this case, it was the National Confectioners Association, which is the trade association for candy manufacturers in the United States. States. So this illustrates the major point, which is that industry-funded research tends to come out with results that favor the sponsor's interest. I did my own little proof of that theorem in 2015. For a year from 2015 to 2016, I collected examples of industry-funded studies. At the end of a year, I had 168 studies, and of those, 156 had results favorable to the sponsor's interest. I only could find 12 that didn't. This was a convenient sample and it wasn't very systematic, but it still produced some quite interesting results. One was the number of food industries, companies, and trade associations that were sponsoring research. The makers and producers of all of these products listed here, I'm certainly not going to read them, but you can see what a long list this is. Everything from sugar to canned foods to coffee, cranberries, pears, and olive oil. Why are they doing this? Obviously for marketing purposes. But that was an unsystematic study. A systematic study was done asking the question, are sugary drinks linked to obesity or type 2 diabetes? They found 60 studies that had examined that question. Of those, 26 said no, sugary drinks have nothing to do with obesity or type 2 diabetes. 25 of those studies were funded by industry. On the other hand, they found 34 studies that said, yes, it certainly has a correlation, and only one of those was funded by industry. And you can bet that whoever did that study never got industry funding again. So that illustrates the major outcome of an enormous amount of empirical research that looks at what is called the funding effect. That is, what is the effect of funding, of industry funding on the outcome of research? Much of this has been done in the pharmaceutical drug industry. Over a 50-year period, there have been literally thousands of studies. And these show invariably that sponsored studies favor the sponsor's interest, that even small gifts influence the outcome of research or practice. The classic example is giving a physician a pad and a pen with a drug logo on it, and that physician will prescribe that drug. And that happens even though the influence of industry funding occurs at an unconscious level. People didn't intend to be influenced, and they don't recognize the influence. They deny it, even when the influence is very, very clear. And this means, of course, that disclosure of industry funding is necessary, but it's not really sufficient to deal with the conflicts of interest that result. How the bias is introduced has also been studied by Lisa Biro and her colleagues. And her analysis of the steps in research and where the bias occurs demonstrates that by far the main effects of the bias are in how the research question is developed. It's one thing to ask, give me research that shows benefits. And it's quite another to ask open-ended research questions. There's some bias in the reporting of research studies, putting a positive spin on them. The conduct of the studies is rarely an issue, so that when researchers argue, well, science is science, the research is fine, that's true. But the bias occurs unintentionally and unconsciously in how the research question is framed. Food companies also put a great deal of effort into influencing nutrition societies. In the United States, we have the Academy of Nutrition and Dietetics and the American Society for Nutrition. And a lawyer, Michelle Simon, has done investigative reports on the effects of that funding on the positions of the society and the positions that members of the society take. And it's very clear that that influence also is there. And the reason why all of this is important is because this kind of influence can influence public policy. Here, for example, is an article about a research group that said that red meat had no effect on health. And it turned out that the people who produced these reports had been partially backed by the beef industry. And so when the new United States dietary guidelines came out this year, and suggested no limits on red or processed meat, even though they've been linked to very serious health problems, we can see how industry influence on research and practice has an effect on public policy. So the question, of course, is what to do about this. And I think we have a very clear agenda for research advocacy. We need far more independent funding for research studies. There has to be full disclosure of industry funding, and we need to find some ways of restricting food industry influence, as the Lancet Commission on Obesity, Undernutrition, and Climate Change said so eloquently early in 2019, a report that I think is one of the most important reports ever written because it deals with food industry influence in such an explicit way. I'll stop here. Thanks very much.
Thank you very much, Marion. This was, as always, a great presentation. It's really shocking to see the influence of food industry in research that is supposed to be unbiased. So we will talk about this later on. The questions will be at the end. So thank you very much, Marion. And now I will ask Laura to please open your screen. Laura Smith is a professor at the Institute of Health Policy Studies in the University of California, San Francisco. We are very happy to have Laura in this panel, and she's going to talk about how food industry has shaped politics around the world. Laura, you have the floor.
Thank you, Juan. Let me just get this slideshow going. Yeah, I'm going to build off of what Marion just shared about scientific conflicts of interest and talk a little bit, both theoretically and practically, about how those conflicts of interest work their way into policy debates around sugar sweetened beverages and ultra processed foods. If I can advance. So we need to start with an appreciation for how big and how global and how concentrated this industry is. When you really look at it, there are just a few very large transnational corporations that are in control of our food system. Sometimes these companies are referred to collectively as big food. At UCSF, my team is investigating the ties between this industry and others like the tobacco industry. There are a lot of front groups that these health harming industries kind of work together with, and trade organizations and so forth. But the scale and scope of this industry is vast. So there's a literature out there on corporate political activities, and essentially this refers to strategies used by corporations to shape government policies in ways that are perceived to be favorable to business interests. And so this is the area that we want to talk about when we're interested in how does biased industry funded science work its way into political debates and support those debates. The corporate political activities unfold at all levels of governance, from cities and municipalities to nation states, regions of the world, Latin America, or the global South, and even at the global level in the UN and WHO and institutions of global governance. So this happens at every level. There are interactions across levels. There's a current push by the food industry to preempt lower levels of government from having the freedom to set the kinds of policies they want, whether it's a global institution constraining global policies, constraining nation states constraining states within them, and so forth. So This is happening at all levels, and it's a very complex situation with a lot of cross-level interactions. The goal at the global and regional level is often to suppress or stall the international diffusion of public health best practices. And we have some really innovative practices. Many of them have been spearheaded by Mexico, and I'll talk a little bit about them. And the goal of industry is often to try to suppress, if a nation state is doing something innovative, the goal is often to use bias science to suppress the diffusion of that to other countries. And this goes back to the point that this is this global industry that is very much trying to constrain actions at all levels of governance. The challenge here is that these food policy debates unfold in an imbalanced political arena where power is distributed unevenly. And so the power of these corporations, because they're so large and transnational, is often daunts the power of the public health constituencies that are trying to promote evidence-based policies. So there are a lot of currently, this whole literature, if you're interested in learning more about it, we're talking about it as commercial determinants of health, a subset within social determinants of health. And there are a lot of taxonomies and various theoretical efforts to kind of capture what's going on here because it's so complex. And this is just one good example. And as you can see here, there are these sort of core strategies trying to frame the debate, get in there on the ground level and shape the way people are talking about it. Are we talking about taxing sugar sweetened beverages as a problem of individuals versus a problem of the food environment? And so framing is very important. And often the science comes in to sort of shape the way actors in the political context are talking about the issue. Influencing the evidence, Marion just gave us a really great overview of how that works. Sometimes the companies themselves have their own internal research divisions, and if they find out something about their product, they may or may not make that public. And then they're also funding external researchers. There's also a lot going on in this space right now with COVID and what are so-called public-private partnerships, where companies come in and say, hey, you know, you've got food insecurity going on. Let us do some corporate social responsibility campaigns to help out and spreading goodwill, greenwashing, health washing in the process. And then finally, there's a lot that they do around direct participation in the political debates, whether this is revolving doors where somebody who worked in government now goes and takes a job at PepsiCo, or consultations, or getting themselves at the WHO in the room lobbying for what they want. So that's corporate political activities. I wanted to share a little bit about how we study this. There are a lot of different methodologies. People use social network analysis to try to map industries and their relationship with government. There are just a host of different quantitative and qualitative methods. One that we've crafted at UCSF is using industry documents. This is a picture of an online archive, and here's the URL to the Food Industry Documents Library. And these are materials that have been obtained either through lawsuits where documents went into discovery and were made publicly available. We try to capture them and index them at our library and put them online so that they can be searched in this search engine through keywords. Sometimes we get these through attorneys or through investigative journalists who have used Freedom of Information Act laws to get information on industry actors and the scientists that they fund. And these materials can be quite revealing in trying to understand behind the closed door of the industry, the private conversations that are going on between executives in food companies and the scientists that they fund. Now, there are currently, there are two major policy debates that are happening, and we're very much studying these through the lens of Industry Documents Library. The first one is the since about 2014, 2016, the explosion of countries around the world that are taxing sugar-sweetened beverages. This is something that the industry has fought tooth and nail against. And Mexico, in fact, with its soda tax was really a turning point in this debate where there was the industry fought it very hard. Mexico prevailed and passed its tax. And then the industry doubled down out of fear that Mexico would become a testing ground for empirical studies of whether soda taxation works or not. That in fact became the case. And industry, even after the tax was passed, fought very hard to suppress the diffusion of this evidence-based policy around Latin America and really the world. And then the other one is front of package nutrition labels. Again, a very, very innovative approach, putting a warning label on the front of a package that says, hey, this is not good for your kid. And it turns out studies in Chile initially and now in other countries have shown that this is a very, very effective policy at steering people away from ultra-processed foods, and therefore the food industry has doubled down in efforts to suppress the international diffusion of this policy approach. And I just want to give you one little example from our research on front of package labeling. The industry has really pulled out some hardball tactics on this one. Claiming that it doesn't work and that and going to international brokers and trade organizations and so forth to try to suppress this policy, keep it from being implemented in places like Mexico, and through multiple avenues. The first being the World Trade Organization, where they have threatened to sue nation states on the grounds that front of package labeling is an unnecessary barrier to trade. They've gone to the World Health Organization's Codex, which is a food standards entity, and they have argued that countries can't use front of package labeling because it's incompatible with Codex standards. And then finally, they got themselves in the middle of the renegotiation of the NAFTA treaty. And if they hadn't been called out, because all of this was happening behind closed doors, and luckily it wound up in the New York Times eventually, that lobbyists were food corporation lobbyists were writing language in the trade policy, the treaty, that would preempt or make it impossible for nation states to use front of package labeling. So this is a real demonstration, just one example of the tremendous power that transnational food corporations have and how they use it to suppress the diffusion of evidence-based policies. And with that, I will turn it back to you, Juan.
Thank you very much, Laura. This was really great, amazing. In a very short period of time, all of these examples of pushbacks and the struggles that we have to face in order to advance policy, including sometimes threats to NGOs and to people in academia, but the same tactics that tobacco used in the past. Thank you very much, Laura. And I'm sure that there will be a very interesting discussion later on. And now I would like to ask Simon Barquera to present his topic. Simon is the director of the Nutrition and Research Center at the Instituto Nacional de Salud Pública in Mexico. And he is going to present the topic, Industry Interferences in Health, Food and Obesity Prevention Policies in Mexico. You have the floor, Simon.
Thank you, Juan. It's a pleasure to have the opportunity to talk in the Consortium of Universities for Global Health meeting, and especially after these great presentations from very admired colleagues that have supported us very much in trying to understand food industry interference in Mexico. So I am going to talk to you a little bit about our experience. I declare no conflict of interest related to this presentation, and I think this is something important in Mexico that we are trying to make very necessary to do. First, probably you already know this, but Mexico is facing a huge epidemic of non-communicable chronic diseases, and this is even worse with the current COVID-19 epidemic. About 80% of all our mortality is due to non-communicable chronic diseases, and we are one of the countries with highest mortality from diabetes. More than 40,000 deaths are attributable to sugar-sweetened beverage each year, and we are one of the countries with highest ultra-processed food consumption worldwide. And the health associated costs of this in Mexico are huge, more than 6% of our gross domestic product. And we have tried many efforts in Mexico to prevent obesity from this toolkit of policies. And almost 40 years ago, we started regulatory efforts of marketing of breastfeeding substitutes. However, even now we are one of the countries with the worst rates of exclusive breastfeeding in children under 6 months of age. And this has to do a lot with this response from industry to these regulations. And from 1999 to 2009, we spent most of the time on research trying to characterize obesity as a priority in public health, basically analyzing national nutrition surveys and income expenditure surveys to understand the determinants, and mortality registers to understand the impact of these conditions. And in 2009, the government developed one of the first initiatives that was a healthy beverage recommendations. And this was only recommendations to orient consumption. Then in 2010, a national policy and the first labeling initiative in Mexico. In 2011, the school guidelines for healthy nutrition. And then in 2014, a sugar sweetened beverage tax and junk food taxes. And in 2020, the warning labels for junk food and marketing regulation. And as something that is very important is to see that for all these obesity prevention efforts, the single most important barrier for implementation has been industry interference. And just I like a lot to use this classification from the World Cancer Research Fund International, which uses the 4 Ds for the industry tactics: delay, divide, deflect, and deny. And we can see these 4 Ds for every single effort in Mexico to prevent obesity. So delay, and they often say we need more evidence or we need more time for consultation. Divide, and they say it is not a comprehensive policy and obesity is a very complex problem. You need a comprehensive policy. Or the problem is street food, not ultra processed food, or industry self-regulation is working well. And in deflect, they use many things such as warning labels will scare people, policies too simple, it will not work, or it will have huge economic consequences. And deny, which I think is the more common of all of them, they say sugary drinks do not cause obesity, or if consumption is reduced, then compensation will occur, so it will have no effect. Or other factors explain the obesity rise. And a few years ago in the Congress, Coca-Cola paid an expert to tell the congressman about how the reduction in tobacco consumption might be explaining the rise in obesity in Mexico, or genetic factors, or a viral theory. So this is very, very common. And the other important factor that I see in Mexico is that the chambers that represent industry are led mostly by multinational companies. And as Laura was mentioning, these companies have a huge power. They don't have a lot of interest about what is happening with health at the local level. And it's a perfect system to avoid accountability for the lack of corporate responsibility, because they have these chambers such as ConMexico that can criticize scientists, even being sarcastic, attack in networks, deny the evidence, create media campaigns against these initiatives without having this consequence in the global index of classifications of corporate responsibility, etc., for these companies that are the ones that are paying for these actions. And these companies are the ones that produce the sugar sweetened beverage and the junk food that is being a huge problem in the country. So let me tell you very quickly three important pushbacks that we experienced in the last years. And I think the common factor is high-level decisions in the government and a huge media strategy from these companies to prevent any criticism to those. So one is the healthy beverage recommendation. Actually, Juan Rivera was the leader of that initiative, and it was an initiative that was, the purpose was only to inform and promote water consumption among the population. It created a very interesting program, and 1 week before the launch of the program, with printed material for at the national level, it was canceled after just a high-level contact from food industry with the government. And it was very surprising. It was very disappointing. And then in 2010, we were asked to develop the technical basis of the National Obesity Prevention Policy. After high-level contacts, it was replaced with a national agreement for healthy nutrition. And the government asked us to try to reach consensus, and the agreement should contain only consensus with the food industry on actions that can be implemented. And finally, in 2014, while we were trying to put front of pack labeling to inform healthier choices, food industry with the government decided to implement and to put in a norm the GDAs, the system that US had, for example, that was made by food industry. And that was a big pushback because we were working on our own system in academia and the CSOs. In 2016, the government created this Mexican Observatory for Obesity that was dominated by multinational junk food companies, and that has half of the chairs in different associations, and was in charge of taking decisions about actions to prevent obesity in the government. I don't need to say that nothing happened during that period of the administration. And in the big wins, I think one that Laura already mentioned was the soda tax. It was implemented in 2014, but in 2015, a very well-coordinated strategy allowed INSP to demonstrate decreasing soda and junk food purchases. That is, it demonstrated impact at 1 year. At the same time, the industry created an unpublished report saying that it had no impact, and they rushed to show this report in all media in Mexico and also in South Africa, Philippines, showing that the soda tax in Mexico didn't have impact. In 2016, a new publication demonstrated a sustained decrease in soda consumption, and the industry started creating CSOs to promote exercise and energy balance, and to promote this message of education, not taxation, as the solution to improving lifestyles in Mexico. And the other big win, I think, is the windows of opportunity, evidence coordination, and ultra-effective media that make possible to have Mexican warning labels in 2020. This is a system that is based on the Chilean system and supported by PAHO and UNICEF and FAO. And we started working since 2007 on a front of pack labeling system. So it took us 13 years. It was very difficult because industry promoted and was able to implement the GDAs in Mexico. So we have to demonstrate that GDAs did not work, and then to demonstrate that the Chilean labels were a much better option. Also, Chile published some impact evaluation. So it was a very good opportunity, and we have the window of opportunity with the change of government and with support from international experts to implement this. And now you can see in the different food products in Mexico these big warning labels advising to be careful with excess of sugar, calories, saturated fats, and sodium. And industry has deployed all known tactics to prevent this regulation. We are now under intensive lobbying at the Congress, media campaigns, high-level meetings with secretaries, interference in discussion of the norm, international trade tactics, economic arguments, and 50 legal procedures from transnational companies against this norm. Now, if you see these images, you can see even from very far away for these products that they don't have now the characters, and they have these big warning signs, and you can very easily identify that these products are high in an ingredient that is bad for your health. And you can also compare between products of the same group. And if you want to, you can choose a healthier one or a natural one. And this is something very important. So we have learned that there are different strategies at different levels that industry use to try to combat these policy efforts. And one very important lesson is that we need, as researchers in the National Institute of Public Health, be able to document all this experience in papers and in books and in scientific literature, so it can be used. It can be useful to make them accountable for these actions, and also it can help other developing countries to see what are the things that will happen and what are the possible solutions. Also, I would like to mention this Nutrition Code, which is an initiative that we created in Mexico, and we have now more than 5,000 health researchers and workers subscribing it. And it's a voluntary code to commit to not engage in interactions with food industry in policy making, in education, and on research. So in conclusion, I think we need a coordinated response to support evidence-based policies with participation of the government, academia, and civil society, and also with support from international organizations. Hopefully, right now, we have a government that is supporting these policies. Sometimes it's not the case. So we really need to make a stronger civil society to be able to build this support on this type of policies. And just to close, last year, with a group of colleagues, we published a commentary in the Lancet talking about the reality that to combat malnutrition, individual interventions are not enough. There are some more things that are required, and among the main four that we identified, one is to avoid food industry influence over research and health policies. And I think this is very important. This is one of the most important things, and many colleagues around the world agree on this. And I think we need to take obesity seriously and non-communicable chronic disease seriously, and try to put this in the agenda and also on research. Thank you very much, Juan.
Thank you very much, Simon. This was also a very good presentation about the Mexican experience. And I would like to start, I will take probably about 5 minutes to summarize some of the comments we have received, both on the chat and on the Q&A, on the question and answer mode. And then probably will allow speakers to spend about 4 minutes each answering some of the questions or comments. The first one is, somebody asks about the food industry impact on breastfeeding, and of course on the implementation of the code of breastfeeding substitutes and other health policies. Somebody reminds us that there is a Netflix series that is called Rotten, and that is really good, so I agree. Then Gina Cosentino says that this reminds her of Monsanto and the impact that Monsanto has had, for example, on traditional food systems, on, on trying to influence our health systems. Also, Laura, I'm sorry, Gina makes a comment to Laura, and she says that in addition to pack labeling, the importance of other education efforts, mass media efforts, and so on. I'm very glad that Keith is saying that CUGH is very interested in addressing this bias, and he would like to receive suggestions from us. So that's really great, Keith. The other, Carlos Santos Burgoa, points out two very important points. One is that there has been a reduction in government funding in many countries, Mexico, Brazil, and many other countries, and this is leaving more space to industry funding research. This is really something that we should be very worried about. And then the influence of government officials and the role, for example, of government officials both on local policies favoring food industry, but also on multilateral bodies, for example, the Codex Alimentarius, and how, you know, some of the government officials are really favoring some of the food industry interests. That's a great comment by Carlos. And the other is somebody's asking to, you know, what strategies have been used for taxing unhealthy foods. I think that sugar, sweet beverages, and junk food. And how can we make sure that we do not affect more the poorest population, because taxes tend to go to, you know, to affect the poorest population? That's a good question. Then somebody also is asking, you know, how were policies like labeling and tax implemented? Were they originated at the local level and then tickling up to the national level, or the opposite? Do they started at the national level? And I think that Mexico, for example, is a good, is an example of starting always at the national level, but maybe you have some other comments. What can we do, somebody asks, to avoid that reputable journals publish research that is obviously, you know, paid by food industry? Is there a way to influence that? That's a very good question. Then Amanda asks a good question that I will read. What can we do to ensure that, so that was reputable journals, I'm sorry. That was the one by Amanda. And then Katie asking, how does INSP work to support community-based grassroots advocacy and resistant efforts like in Chiapas, for example? And somebody reminds us that the Navajo Dine Nations were also instrumental in passing the tax. And I think that there are enough questions. I will just add two more, just to then let Marion and everybody speak for 4 minutes each. Marion, is it possible to have nutrition relevant food policy funded by food industry that could be free of conflict of interests? Do you think there may be ways and rules to achieve this? And the other question, Marion, even if we do not directly favor sponsors or food industry, isn't just the endorsing by association enough? If I associate with a company, maybe I am endorsing that company and their products. And that's a very good issue that we discuss. And then Laura, in what instances and under what rules should public health community engage in dialogue with food industry? Or do you think that this really cannot happen? I mean, because we have very opposite objectives. Public health people want the population to reduce the intake of sugar, sweet beverages, junk food to avoid deaths, and companies want them to increase their, is there, you know, any value in a dialogue? And finally, Simone, do you think that there is a double standard from companies? For example, some companies in France produce yogurt without sugar, but in Mexico you cannot find, or I mean, you barely can find yogurt without sugar. So is there a double standard? Are we, you know, middle income and poor countries, second-rate countries for those companies? So let's have Marion, and it will have to be brief, Marion, I'm sorry, but if you can address, you know, whatever you want. There are many questions.
Yeah, I'm laughing because there were so many. Let me deal with the one about whether it's possible to have nutrition relevant rules in a situation in which there are partnerships with the food industry. And for that, I want to go back to the paper that I showed in the last slide, which was the Global Syndemic Report that was published by The Lancet in January 2019, which I think is one of the most important papers ever published. about anything having to do with food and nutrition policy. It was one of 2 papers that came out within a week, 2 Lancet Commission reports. You, Juan, were on the other one, I think, the Eat Lancet report and the Global Syndemic. And what they tried to do was something that I had never seen before. It was to link food and nutrition policy in order to do what they called triple duty actions, which was to address undernutrition and food insecurity, overnutrition, obesity, and climate change with dietary recommendations that would affect all 3. And I had never seen anything like that before. I also never saw anything like what was in the Global Syndemic report, which talked about the damaging influence of the food industry in trying to create dietary recommendations that would promote healthy diets and sustainable diets. And that report came out with a set of recommendations that I think everybody needs to know about. And they were very clear. They said the food industry cannot be involved in public policy. They should not have a seat at the table because their interests are diametrically opposed to those of public health. We need restrictions on food industry marketing, especially to children. We need restrictions on food industry advertising. They cannot be doing the kinds of things that we've just talked about here in either research, public policy, engagement with actors, and so forth. It was the first time I had seen a major level international commission make those kinds of recommendations. I thought it deserved much more attention than that report got, and I teach it in every class that I teach. And so if we're going to do something about this, every single public health initiative is opposed by the food industry in every way possible. That has to stop.
Thank you, Marion. That was really great. Laura, would you like to address whatever question or you want to address?
There's so many good questions. I'm glad I kept a list of them, so I'll think about them more after this. Just to pick up on what Marion said about, is it dialogue with the food industry and collaboration possible? I think where the place, there can be an in-between gray area where governments use their leverage and at the same time try to get the industry to change its behavior. And an example of this would be the UK sugar tax, where there is the muscle, the stick of government, we're going to tax you, but they made a graduated tax on sugar sweetened beverages so that industry had the incentive to reformulate and to make lower sugar products. And a report just came out this week showing that was very successful, that in fact their reformulation has happened. And so that's an area where you're not trying to get rid of the industry necessarily, but you are trying to make it do the right thing. And so it's not an on and off switch in terms of, how do you set policy? You have to have government, I believe, you have to have the stick of government in order to make the industry do anything for health, but it's possible that they can stay in the game, so to speak. On the top down versus bottom up approaches to how do these innovative food policies kind of diffuse? And people were mentioning the Navajo Nation. Here in the United States, we are home to many of these corporations, and it's very unlikely that we will be able to do what Mexico did. And because of our system and because the corporations were launched here, and there's so much, they're so powerful, it would be very difficult, I think, at this point in time for us to pass a front of package labeling law or a soda tax. However, in our federated system, local governments have been innovating, and the case of the Navajo Nation is wonderful. In 2014, they passed a tax, and they're a sovereign nation, so they could do that, and they just renewed it. And we have a number of cities in California and other 7 cities that have passed soda taxes. What happened there was the industry came in and paid off our state legislators to preempt our local taxes. We were here in California, we were poised. We had a bunch of different counties and cities that were ready to take the lead of, follow the lead of Berkeley, Oakland, and San Francisco and Albany that have taxes. And somehow the American Beverage Association wound up at the mansion of our governor. And overnight we got preemption. And so that it put a complete chilling effect on soda taxes. We have a series of papers in the American Journal of Public Health about this issue. It's something, preemption is a strategy that's been, really used to great success by the tobacco companies. And so now everybody's following in suit, whether you want to, stop cities from plastic bag bans and straw bans and bottle bans, all the way across the board. And it's a really, really important issue that is a little bit wonky, so it doesn't get the kind of public attention that it deserves. But this is really anti-democratic when a state is telling a local government what it can and can't do for the health of its citizens. I'll take one more maybe on this issue of how do we stop industry conflicts of interest and their ability to pollute the scientific evidence base with junk science. And there are a lot of ways to do that. One is what Simone recommended, suggested a voluntary system for getting scientists to come out and say they're not going to take this kind of money. There's a challenge here because at least here in the United States, there is no National Institute on Nutrition. Nutrition lives in all of the different disease-focused institutes, cancer, but there isn't a centralized place where basic research on nutrition can happen. And I think this is true in a number of countries. Mexico is a really innovative country in that you have a place in your public health institute where nutrition has its own place to live. And I suspect that explains why in Mexico, one of the reasons why Mexico has been such an innovator. But that isn't true in a lot of countries. And unfortunately, NIH is the largest funder for global health research in the world, our NIH. And we really need to make a push for that. We have the same problem with climate change. There's no place where funding lives for that kind of research. But I do think that the industry documents are a really powerful way to call out and name names. When you can, in the words of a Coca-Cola executive or the scientists themselves, say, hey, you're talking to Coke about how to spin your own data, and we have it in your own words. That's a very, very powerful tool. Light is the best antiseptic, right? And being able to shed light on who's who in this world is a very powerful thing.
Thank you very much, Laura. And Simone, I would like to ask you to spend your last 3 or 4 minutes, probably 3, answering whatever you would like to.
Thank you, Juan. Yes, I will be very brief. On the grassroots organization to develop these policies in Mexico, as Juan mentioned, is centralized and that has some benefits. However, the organization and the support, it has a grassroots component. So we develop the evidence and then we work a lot this evidence with civil society organizations, which are very well organized in Mexico. And then the supports comes that from bottom up also we have professional organizations and civil society developing and discussions, and then this is used again to adjust the policy. So I think it's a good combination that is working. And in the part of the government officials, that the comment of Carlos, I think it's very important to develop transparency mechanisms and open government initiatives to and also even maybe observers as in the elections, to have someone from WHO or from the Codex come here to watch what is these companies like Nestle discussing on the Codex of breastfeeding, because it's amazing what they say in these closed meetings here, and it has nothing to do with what they report then internationally. And finally, the one that you were saying about the harmonization of the composition of the food products is amazing. We have demonstrated that products in Mexico have more sugar and more salt, and in different publications, and probably that's why it was so easy for hundreds of these products in 1 or 2 months to reformulate and to be able to take out 1 or 2 seals from the box, because they already are able to do that in other countries. Thank you, Juan.
Well, thank you very much to Simon, Marion, Laura. This really, I think that this is one of the greatest, of the best sessions I have been lately. And I think that it's also very relevant to public health. It's amazingly relevant to public health. So I'm very glad that we had this, session. And I also would like to congratulate the participants for their comments, their questions, and I hope we had more time because there were some additional questions that we didn't have time to address. Thank you very much to everybody.
Thank you.
Thank you, Juan.